You're listening to the St. Louis Pain Expert Podcast with Dr. Dave Candy, St. Louis's leading expert in chronic pain relief. Dr. Candy specializes in helping women age 40 and above to overcome chronic nagging aches and pains without medication, injections, or surgery, so they can stay active, mobile, healthy, and independent. Whether you're suffering from pain yourself or know someone who is, pain's a universal experience that affects us all, but that doesn't mean you have to suffer. Knowledge is power, and having the right information can help you or someone you love get on the road to recovery. On the St. Louis Pain Expert Podcast, Dr. Candy talks with other pain experts from around the world to give you the information you need to recover, the peace of mind of knowing that you're not alone, and the hope that lasting relief from chronic pain is possible, and it doesn't require relying on pills, injections, or surgery in order to do so. So sit back, relax, and open your ears, mind, and heart, and let the healing begin.
Welcome to the St. Louis Pain Expert Podcast. I'm your host, Dr. Dave Candy. I'm here today with Dr. Andrea Davis of Davis Physical Therapy and Sports Rehab in Medford, New Jersey. Dr. Andrea has been in clinical practice over 20 years, and I'll let her fill you in a little bit more on her history. We're going to be talking today about chronic knee pain is a population that we both see a lot of. And so we'll be talking about that and other chronic pain issues that we tend to run into in our practice. So, Andrea, thank you for joining us on our podcast today. Can you tell us a little bit about your history and about your practice?
Sure thing, Dave. Thanks for having me. So I've been in practice about 20 years. Our office, Davis Physical Therapy and Sports Rehab, we are coming up on our 4-year anniversary this May. I've been in the area for a long time and just really was becoming frustrated with lack of attention to detail in patient care. And it kind of just got to the point where I was like, why not? I have a nice following. I think I can do things a little bit better. And so here we are 4 years later and going strong. So.
Well, congratulations. Yeah, that's a big mark. You must be doing something right and helping lots of people if you're still in business 4 years and doing well. Can you tell us a little bit about kind of the stereotypical patient that you see with any type of chronic pain? I know you mentioned chronic knee pain is something you see a lot of.
We do, yes. So we see a fair amount of chronic knee pain. Typical presentation, arthritic knee. Has been having pain for quite some time. Episodes have gotten progressively worse over the years, where function is now being limited. People have difficulty with daily tasks, up and down the stairs, walking longer distances. But when they go and have x-rays taken and speak to their doctors about it, the progression of the arthritis is not quite bad enough that they would be a candidate for a knee replacement. So options like injections, Synvisc, Orthovisc injections, gel shots, are given, or just cortisone steroid injections are given to the patient. So they're not always successful, and they're not always truly happy with that type of a plan of care as the end all be all. So they've been turning to try and get a little bit stronger, and we've discovered this nice little pocket of ways that we can help strengthen the quadricep muscles, the thigh muscles, to alleviate some of those pain complaints.
Can you tell us a little bit more about some of the struggles that those patients go through, some of the things that they're worried about, some of the things that it stops them from doing in their everyday life?
Sure. Yeah. I mean, the biggest complaint that we see is difficulty participating in family activities, spending time with their grandchildren, getting on and off the floor with their grandchildren, in and out of chairs. And for outings, summertime, we live, our area of New Jersey is fairly close to the seashore. So going to the boardwalk, walking in the sand, walking on the beach, it's a pretty common event once the weather breaks. And, people that have been able to do that their entire lives are really struggling with it. And it starts to, lead to some mild forms of depression. When you're not able to do what you always have done or want to do, when your options are so limited, it really does take a toll on your mental psyche. So it's unfortunate, but these everyday struggles really seem to be happening more and more often, and the options are so few that are non-medicated.
We see that a lot too, that depression is very, very common in the knee arthritis population. And actually some of the newer research coming out is predicting that unaddressed depression is a negative predictor it's a predictor of having a poor outcome after having knee replacement. So it's great that you recognize that in your practice and that you're doing things to kind of help those people to feel better and hopefully even avoid that knee replacement in the first place. Can you tell us about some of the things that you do to help people that kind of set you apart from the solutions they have had in the past that haven't worked?
Sure. Yeah. I'm a big proponent. I've gotten into over the last 6 months or so of whiteboard sessions with patients. And what that means essentially is you take a very large, clear whiteboard in your session with your patient, and you're actively brainstorming with them. What things are they having difficulty with? And then they rank them. So if the stairs are the most challenging thing, we rank that as number one, getting on the floor, walking longer distances. And then we actually start writing down what their goals are. So on one side of the whiteboard, we have the problems, challenges, and difficulties. And on the other, we start listing what they want to do and where they want to be. So not only is there a visual for the patient to kind of connect the dots on where they are and where they want to be, but they also, we listen and we try to articulate for them that there is a plan of action that can be put into place that we can move closer to those goals, that it's not hopeless at this point. So that's one way in which we differentiate ourselves. The other is we've invested quite a lot of time, education, and research essentially into some newer treatment technologies. One of which is it's called Indiva radio frequency therapy. I guess you could say it's like ultrasound, old school ultrasound on steroids, but in which it operates on a cellular level and works from the inside out. So actually penetrates the cells at 448 kilohertz and reduces inflammation. Honestly, if I hadn't seen it for myself, I would also think that I was a little being silly and crazy, but within 1 or 2 sessions, people are feeling tremendously better. So 1 or 2 sessions and the inflammation, the complaints of pain is less enough or lowered enough that we can actually perform more exercises than we would have been able to previously.
Wow. Yeah, that's something that I actually wasn't aware of. So I may have to get more information from you on that down the road. On the whiteboard sessions that you use, it really sounds like then with those sessions that you're kind of taking the patient's outcomes that they want, and you're directing your treatment around the things that they've told you that are their problems. Is that kind of what you guys do?
It is. And I think that's actually one of the reasons that we've grown so rapidly since we opened is it's less about what I think they need. It's really 100% about what they need and what they think they need. So to be able to put that out there, first listen to them, and then reflect that back in writing right there in front of them that, one, we hear what you're saying. You're frustrated, you're angry, you're not functional. And then for them to actually see in writing, okay, you want to go up and down the stairs, you want to be able to walk to the end of the block. These are things that we can then carve out smaller goals where they feel accomplished. And a lot, I don't know about you, Dave, but what I've seen in chronic pain is it's so hard when you just focus on just the pain that it may never go away 100%. So we have to find these other smaller milestones to try and drive towards and accomplish. And it's kind of nice to see that happen.
I would agree with you that I think most people, when you talk to them, they can deal with some pain, and that it's kind of a running joke among health providers that everyone thinks they have a high pain tolerance, but everyone can tolerate pain unless it starts to impact them and stop them from doing things that they love, and that's really when it becomes intolerable. That when it's stopping you from going out and walking on the beach, you're playing with your hearing children, or you're going up and down stairs, or the other things that you mentioned that are just vital to your everyday life and your happiness, and it starts causing you depression, then it really becomes something that you need to address. So yeah, I think taking it outside the pain and bringing it back to what's going to make that person happy and make their life more fulfilling is a great way to go about treatment. It's similar to what we do. Can you tell us a little bit about your education, your background, and how you became a pain expert, and kind of how you got into this world of chronic pain?
Sure thing. I guess the most is through experience. So in 20 years, you see a lot. You see a lot of things in 20 years. I was fortunate enough, I guess, one of my personality traits, I'm fairly ambitious. So when I started practicing PT, I was a hungry therapist, and I would go pretty much hang out with any doctor that would allow me to hang out with them and just absorb how they talk to patients, absorb the experiences patients were having, and then over time started to develop my own thought processes on what was successful, and through observation and of course practice, like we all do, start developing this type of communication system that puts the patient first and really tries to validate what they're feeling. And I think honestly, it's gotten so much more refined for myself. I'm in my early 40s, and I unfortunately have been experiencing a significant amount of hip pain in both my hips. I was a high school athlete, collegiate athlete, fairly high level, participated, coached Division I for years. So when I started experiencing this pain, it kind of flipped the script on me to then experience what is considered to be chronic pain, everyday pain, going up and down stairs, getting in and out of the car, walking long distances, can't go for runs anymore. It makes you a little bit more sensitive to what people go through when you actually literally walking in their shoes. So, through that, I really kind of try to embrace that and talk to people as if I would like someone to speak to me. And when I started going to different doctors' offices, I was dismissed mostly because of my age. Like, oh, you're fine. It can't be that bad. And clearly, if you're showing up to a doctor's appointment, it takes you a long time, most people, to get to the point where you ask for help. So to arrive at that appointment and be dismissed about the complaints it's a little bit unnerving and frustrating. So just adopting the mindset that I won't do that to patients that seek help, and really try and figure out how we can help them.
And I think that's a great point to make, that, sometimes the words that people hear from their medical professionals, whether it's comes off intended that way or not, that, to say that nothing's wrong, your x-ray shows that nothing's wrong, clearly there's something wrong, because otherwise they wouldn't have been seeking out treatment. So that's, great that you can kind of walk in their shoes and you're sensitive to that, and that you can now kind of communicate to meet people's needs, that if they're in your office and they've worked up the courage to come see you, something's clearly wrong. And it's great that you're finding ways to help people out with that. So what are some of the kind of common misconceptions that you hear about chronic pain or chronic knee pain from your patients, some of the labels that sometimes get put on people? Can you speak to that a little bit?
Sure. First one is, you're just old. You should accept it. with the patients with knee, well, you beat it up when you were younger and now it is what it is, which I just find completely ridiculous and frustrating and infuriating, to be honest. There are 75-year-old men and women that are far better shape than myself. So age really is a misnomer. It's unfortunate. That's one. Sometimes, chronic pain can be labeled, from what I've seen, is, they just want medication, or they're just kind of working the system because they don't want to be, contributing, don't want to be working. And that's really, of course, you're going to find that here and there, but that's not the norm. Most people want to be a productive, functioning member of society and really have something to contribute. And when the pain's setting in and it's just blocking their ability to do that, it's extremely frustrating. And complainers, that's the other one that, oh gosh, yeah, she always complains about her knees, or always complains about her back. Something's always wrong. Again, you don't know until you've lived with it. And most people with chronic pain, most people I would not categorize as those that would complain very much, except in serious cases.
Yeah, I almost find the opposite, that people are afraid to talk to their family members or friends about it because they get dismissed. They say, "Oh, you're just complaining," or "Oh, you're always talking about this," or "You're making it up," or "It's all in your head." And so, largely people just suffer in silence.
Yep.
And by the time they actually work up confidence to come in to see me or you or someone else, they're suffering pretty bad. And oftentimes it's been going on a long time.
I agree. Yeah, it's unfortunate.
So let's go back to some of the things that you do to help people with chronic pain. Can you tell us more about some of the specific treatments that you use and kind of what sets you apart?
Sure. So, a big one is really just education, I think. In this day and age, most people are coming in relatively educated. Dr. Google gives them a fair amount of information to have a nice base, but really to be able to sit down and speak with authority and make sure that we're on the same page. That has to be the number one thing. And we spend more time discussing and interacting as much as the physical examination, but really sitting there and trying to get on the same page with what they know, what I know, what their body looks like. And then we'll pull out the models and whiteboard. And we'll also, we have interactive TVs in the office where we'll throw up the anatomy and go through things. What I've found is the more people understand, the more compliant they are with their care plan. So we spend a lot of time sitting and discussing with them, answering all of their questions. So they do feel empowered and ready to move on. So it becomes easier for us to have dialogues about options of care. And I try to lay out as many options of care as we can. So for instance, chronic knee patients, there's this fine line with these arthritic knees that if you do too much, then you're going to inflame the joint. But if you do too little, you're not going to change anything at all. So we all know the research indicates that hip strength, core strength, and quad strength are needed to support the knee joint and unload the stress on that arthritis. So one of the things that we've been doing is restrictive blood flow therapy. So it's tourniquet therapy that once you place a tourniquet on the quadricep, it shuts off about 80% of blood flow to that musculature. But with that restriction in blood flow, you're actually mimicking a high load lift. So in order to build your leg strength, my leg strength, and patient Smith's leg strength, you need to have some resistance for that quad to be working against. Chronic knee pain sufferers can't do that. They can't tolerate the load of that resistance. So by doing no resistance, but shutting that blood flow off, we can mimic the same exact chemical response as we would if they were doing a loaded lift. Does that make sense?
Yeah. To me, it does. Just kind of to clarify for some people who may not be familiar with the blood flow restriction training, that when you exercise at a high intensity, it actually stops oxygen to the muscle, or you're working without oxygen. But since people with knee arthritis can't train with that, that it cuts off the oxygen and produces the same, I guess, you say physiological response that it would working out with high weights, just without the actual load on the joint.
Correct. Yeah. So you're creating new muscle. Basically, the long and the short of it is you're trying to build new muscle without causing irritation to the joint.
Yeah. And another.
No, I was just going to say it's pretty cool.
It is, yeah. Another thing that you kind of glanced past, that you said we all know that hip strength and core strength are essential to knee arthritis, and you and I being in the industry do know that. But I think a lot of people they get fixated on the knee strength, the quad strength, and forget about that. That in the kind of lay population, that a lot of knee problems are caused by hip problems or back problems or ankle or foot problems. And it's not always in the knee. So I think it's great that you guys look outside of that.
Oh, thank you. Yes, that's a big part of it.
In more detail, how do you progress your approach? That so you start doing this blood flow restriction training, or you're training the hips or you're using what was the modality you used again? The new ultrasound,
The radio frequency therapy.
the radio frequency therapy. How do you progress the treatment from there? How do you decide whether it's working or not working? Or
I mean, just like in any other situation, they come in each visit. We discuss: are you better, worse, or the same? It's very common nomenclature, but better, worse, or the same. And then each answer indicates which direction we're going to go in. If they're feeling better, which to me, better or the same or relatively the same category, then we progress. So we either increase repetitions, we add one or two exercises, but it's a constant state of progression so that we're moving forward. The idea is to prescribe exercises with the highest amount of efficacy and the lowest amount of risk for causing pain. That's the trick. And that's where the real expertise comes in with us as physical therapists, and our education, as long as it is being able to determine which exercises make the most sense for this person in this moment without placing them at risk for a sudden increase in their pain complaints. So that's a daily dialogue that we have. And then, of course, if they're worse for whatever reason, whether it's something that they did on their own or something, home exercise that we went through, then we make modifications and adjustments to that.
And do you educate people on some of those home activities that they're doing too? That say I went to the beach or I went and skated with my grandkids or whatever it is. Do you give people some guidance on how much to do those daily activities in addition to just your home exercises?
Oh yeah, for sure. So every time that we depart each other or we leave each other, we go through do's and don'ts and pros and cons. What are your plans for this week? Okay, I'm going to go to the park with my grandkids. Okay, so remember, you don't want to be squatting too deep. That puts a lot of pressure on it. Try and limit your walking time. Keep it under whatever the amount of minutes that we've discussed, 7 minutes or whatever it is. So we do, yes, we go through that education. It's important. It's important to ask those questions as patients that are seeking care and under the care of a physical therapist. It's very important for them to advocate for themselves and ask more of us as their provider to educate them as much as possible.
So it's not just exercises that you're giving them, but kind of almost a lifestyle plan for the upcoming week or 2 weeks or however long it is until you see them next.
Absolutely. Absolutely. And I think that's something that, I wish more of us would subscribe to. I know you do it, and I know, a fair amount of people that do it, but there's just so many therapists that I think we could, as a profession, be doing a better job giving full circle education for our patients.
Well, outstanding. In closing, what are one or two pieces of advice that you'd give someone who may be suffering with chronic pain right now?
I would say the biggest one is advocate for yourself and don't feel bad about it. If you're hurting and you feel that your provider is not paying enough attention to you or not giving you, essentially what you need or enough direction in your plan of care, then maybe it's time that you start talking about finding a new provider. Not that I'm into second guessing other people's providers, but I firmly believe that you should be confident in your plan of care and confident in the health practitioners that you're working with, that they have your best interests at heart. So definitely advocate for yourself. Ask questions and educate yourself for sure. I mean, we joke in the industry about Dr. Google, but there is some good that comes out of educating yourself where you can speak knowledgeably and intelligently about some of the things that you're experiencing. And then don't wait to seek care. I mean, physical therapy is so much more than post-surgical. It's so much more than, do your kickouts 3 times a week for 4 weeks. The knowledge base that we possess is just, it's incredible, really. And if patients really want to start from the ground up, I encourage them to consider looking at physical therapy as a first option, especially ahead of any kind of heavy pain medication.
Now, if someone is looking for a provider, what qualities would you say someone who's suffering with chronic pain, either for the first time and just hasn't sought out someone to get treated before, or someone who, like you said, may not be completely satisfied with the outcome that they're getting. What qualities would they look for in seeking out care?
I think providers need to be good listeners, or at least perceived as a good listener. Then, the patient is able to relay all of their concerns in a timely manner, of course, but still be able to get that across. And someone that's going to advocate for you, or I like to call it quarterback your care. They're going to be the quarterback for your case and help you get to where you want to go. It may not be in 2 weeks, but certainly get you on the right path and have regular check-ins to make sure that if it's not going as planned, that there are alternative plans to take place.
Well, Andrea, it certainly sounds like you do that in your practice. So, you've been successful in the last 4 years in your practice, and being in practice for 20 years. Keep up the great work. And, if someone's listening to this that's in the Medford, New Jersey area, how would they get in touch with you if they would like to come seek you out for treatment?
There's multiple ways you can seek us out on the website, which is Davis, P as in Paul, T as in Tom, SR.com. That's www.davisptsr.com. Or you can give us a call at the office. It's 609-451-5404. We'd be more than happy to discuss that. Thanks, Dave.
No problem. Thank you for taking the time to spend with us today. We'll put that information in the show notes as well. So thanks again, Andrea, and I hope you enjoy the rest of your day.
Oh, thanks, Dave. Thanks so much for having me. You too.
You're welcome.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com or call Dr. Candy's clinical practice, Movement for Life, at 314-941-3970. Movement for Life offers free consultations called discovery visits to people who are serious about discovering how they can relieve their pain and get back to the happy, healthy, and active lifestyle they deserve. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.